Today our topic is all about higher mental function. What do you mean by higher mental function? Higher mental function is a part of an examination which comes under the whole of the nervous system examination. We have sensory system examination, we have motor system examination, higher mental function examination as well as the cranial examination. So higher mental function is actually to look certain things which includes consciousness, it includes the memory, intelligence, whether the patient is cooperative or not, the attitude, the insights, judgment, reasoning, sensory disturbances, motor disturbances, all those things comes under higher mental function. So it is it's actually a part of a general physical examination. When you do general physical examination itself, you look for the appearance, you look for the consciousness, cooperative, you look for the build, development, skin changes, hair. You see many things in the general physical examination. So certain things comes here as a part of higher mental function. For example, consciousness comes in higher mental function. The appearance comes in higher mental function. The behavior comes in higher mental function. So there are certain things which comes in even in the general physical examination which is a part of a higher mental function. So this is the pro forma for higher mental function examination. As all the other examination, the basic things, name, age, gender, address and date and time of examination. As you are doing normally for any examination, the documentation purpose is very important. The identity mark, the age, all those things are very important. So here also the same thing comes. So coming to the main part, we'll list out the things first. Consciousness, general appearance, behavior, orientation to time, place and person, motor disturbances, sensory disturbances, emotional state, thought process and content, attitude and insight, intelligence, memory, judgment and reasoning, language and speech. So each one by one we have to discuss one by one. So this also comes as a part of your skill certification. So you should know everything, each and everything in very detail. Before that, you should know something about mental status exam. What is mental status examination? So mental status examination or mini mental status examination, MSc or MMSc, is a routine thing done as a part of psychiatry or higher mental function evaluation, which is done by the medicine department as well as the psychiatry department. So all the things what I told earlier also comes as a part of the MSc. So coming one by one, first coming to the consciousness. Consciousness, as you know, consciousness and cooperative you can see both together. Consciousness, the person can come as conscious or unconscious. And in unconscious or subconscious, you can tell two more things you have to know is about stupor and coma. What do you mean by stupor and what is coma? Okay, so that will come to that. So consciousness, you know, the person is alert, is cooperative, is conscious, is very easy for the doctor to examine. But what about the other conditions? The patient is subconscious or unconscious. It's very difficult to examine. So what is a stupor and what is a coma? For example, if you are giving any pain stimuli, what will be the result from the patient side? When you give a pain stimuli, when you have a deep pain, you squeeze the muscle, they show some response to the pain stimuli, some kind of response, but they are almost unconscious only. Okay, stuporous. Coma means they are unresponsive. They don't respond to anything. To any external stimulus, they don't respond to any stimulus like pain or whatever it is, vibration, pain, whatever is studied in sensory, they don't respond to anything in coma. In stuporous, they respond to some kind of response will be there from their side. For example, you squeeze a muscle, they show some response. That is stuporous. Okay, stupor. So consciousness, conscious. It can be subconscious, unconscious. That's why it's very important to know the Glasgow Coma Scale, GCS. You might have heard of GCS. Glasgow Coma Scale is very important when the patient comes to casualty. There is a scale between 3 to 15 it is. 3 means very bad, 15 is very good, high it is. So it's a scale between 3 to 15. So Glasgow Coma Scale is very important to know the consciousness level mainly. It is EMV, eye response, the motor response, the verbal response. EMV, eye, motor, verbal. So that is Glasgow Coma Scale also comes in consciousness. When the persons go to casualty, you have to take the GCS score. That is Glasgow Coma Scale. So consciousness, whether the person is conscious or stuporous or coma, okay, that is the one you have to look for in consciousness. What about appearance? So appearance you can see for the manner of dressing, the personal hygiene, the level of cleanliness, how they appear, how they dress, how they button the shirt, whether they are putting the socks in one leg, the similar kind of socks in other leg. These kind of things, shoes, socks, level of eye contact, the person is looking at your eyes, the eye contact level, whether the person is restless, cooperative, anxious, the person's general appearance, mainly the build, the posture, everything can be looked. So the clothes, mainly the hygiene, especially the hygiene you have to look, and whether they are having eye contact to you. So the build can be seen as a part of that, the manner of dress, and mainly the cleanliness. The personal hygiene is the one you have to look after. So the posture is a very important thing. When they come across, you can see the posture. Suppose a stooping posture, as I earlier told you Parkinsonism in the practical for one batch. The Parkinsonism later stages what happens, or middle stages what happens? The posture of Parkinsonism will be stooping posture. You feel that they will fall right now. When you see the person walking with the Parkinson's disease, you feel that they are like falling, they are trying to catch the center of gravity, you feel like they are going to fall forwards. So the posture also is very important when they come. Posture is very important, the social manners are very important, personal hygiene is very important. Then the attitude of the patient, the way they behave to us, the way they talk to us, as someone told them, or the way they talk to us. So everything comes in appearance. These all things comes in appearance. Okay. So any tremors, even when you see a person or patient, when resting tremors is there. When they hold a pen or something, they like external intention tremors can be there. When they hold a cup of tea or then have a glass of water, they have tremors. That is intention tremors. When they are the resting state, it is resting tremors. So see for any tremors, any tics, involuntary movements. Okay. So these are things you come to see. We have to be clear when you see the appearance. And even behavior also comes with appearance. The third one is behavior. It also comes with appearance, because the person, how he talks to us, how is the social manners, whether he is very in aggressive state or he is very rude to us, or so just simply laughing, keeping on laughing, some of them. Because sometimes some of them will tell, pagal wala, like they are simply keeping on laughing, whatever you ask they laugh, not smiling. Smiling and laughing excessively is different. Smiling is a good thing, you can smile to a person, but laughing simply for no reason is not a normal state. So behavior is very important. Along with appearance, you can see behavior, the way they approaches to you, the way they talks to you, the way they answers to you, the question what you ask, according to that whether they are answering or not, whether they are very rude to you, they are aggressive to you. Okay, these are the behavior can be checked along with appearance. Okay, that is when you take the general things, when you ask the main complaints, when you ask them, okay, where are you from, why did you come, from that itself you can understand the behavior of a person, whether he is cooperative to you or not. So cooperative is very important there. That comes very important in that. Consciousness and cooperative itself comes in the first part. Whether the person is conscious, whether it is cooperative to the doctor. Okay. So if it's unconscious, the bystander should be cooperative. So that is a different scenario. So here behavior appearance has to be checked together. Okay. Now the main thing comes is orientation to time, place and person. What do you mean by orientation to time, place and person? It's easy, no? It's there in the sentence. Orientation to time, place and person. How can you check the orientation? Correct. If suppose, example, if I am asking Vishnu, suppose, what is the time right now? Okay, I don't have watch, I cannot tell the exact time, but what Vishnu can tell is, it's around 2:15 or 2:20 can tell, in the afternoon. So he is oriented to time. Suppose I am asking him in the place, where is he right now? Yeah, Vishnu, where are you right now? Yeah, so he is oriented to place. Now who am I? Yeah, so tell the name of the person. Okay, he is oriented to time, place and person. If he is telling it is afternoon, it is afternoon at 2:15 or 2:20 around PM. The place is in Mangalore and he knows myself, the person whom he is talking. Or I can ask him the person near to him, who's near to him. If I see him directly, I can tell, okay, someone is sitting near to him, can you tell the person's name? A known person, okay, not a stranger person whom he doesn't know. So oriented to time, place and person. Right now if you are asking me, I'll tell the time. It's around 2:20 PM, 2:22 PM. I am right now sitting in the physiology library room and I am talking to Vishnu. So that I am oriented to time, place and person. So that is the meaning of orientation to time, place and person. What is the time right now? Where are you staying right now? Where are you now located right now? And which person I am talking of? Some person you can just point out and ask him. Not strange persons, the person whom he knows. Okay, you can ask him, who is that person, who am I, or what, such kind of questions can be asked. That is orientation, time, place and person. That is very important. Because why it is important? Orientation is the main aspect, because if you have an head injury or something, what happens? He is not oriented to time. He doesn't know the person. He can have amnesia. If he has amnesia, what does he answers? He might be not knowing the person who he might have brought to the casualty or even to you, or whom he doesn't even cannot understand, like in Alzheimer's disease, in dementia. Sometimes he cannot understand his son. The person cannot understand his wife sometimes. So dementia or amnesia, dementia disorders commonly seen, Alzheimer's disease. There can be amnesia. So that can be very important when you see for the orientation to time, place and person. This can be easily understood. If they are in old age, like 60, 65 years, if they are not oriented to time, place and person, it can be a part of dementia. So you have to note it down there itself. It can be, it cannot exactly say the final diagnosis. It can be a probable diagnosis or differential diagnosis. It can be a part of dementia or as a part of head injury, a normal accident. Might be cannot remember the thing what has happened after the accident. Before that he remembers everything. So that is the situation you can see for the orientation to time, place and person. Next one, motor disturbances. What are the motor disturbances? Already your motor system examination is over. The practical aspect, you can tell the motor disturbances. What can be the motor disturbances? So you can see the different types of involuntary movements like tics, tremors, fasciculation, or nystagmus, myoclonus, athetosis. So what we have studied earlier in the motor system examination about the motor disturbances, just we have told about a few things about our resting tremors. Mainly resting tremors is a part of the involuntary movement. You see intention tremors, tics, fibrillation, fasciculation. So any disturbances in the motor system examination, even the rigidity, the flaccidity, the spasticity, all those things comes as a part of the motor disturbances. So here some of the things I have shown in the picture is tremors, tics, the dyskinesia can be seen, or akinesia can be seen, Parkinsonism, myoclonus can be seen, athetosis, even other things are chorea, nystagmus, balismus. These are the involuntary movements or abnormal type of motor, or you can say motor disturbances. So these are things which comes under motor disturbances. So when you go to psychiatry, the most common case what you see is schizophrenia. Schizophrenia is a common thing what you see across psychiatry. It's not a, you cannot say at what age you can see it's 30, 40 or 35, 25. It can be in any age group. It's a combination of, you can say, delusion, hallucination, a different type of like lack of initiative. The negatives can be there, positives also can be there. The positive symptoms and negative symptoms. So as my friend told you, schizophrenia is a difficult thing to take a history of schizophrenia, because today if they take the hallucination, tomorrow it will be delusion. So different days, a different history can be heard from the patient of schizophrenia. So the different types of schizophrenia, paranoid schizophrenia, mainly the simple schizophrenia. So paranoid means the old word for delusion is paranoid schizophrenia. Then there are symptoms like catatonic symptoms, mainly you can see in schizophrenia, like catatonic symptoms in the sense negativism. Okay, then hallucination can be seen, delusion can be seen. So you should know something about delusion, hallucination, illusion. What are these things? At least you should know what is that. Actually, learn separately when you go to psychiatry, but still, just to know what is illusion, what is hallucination, what is delusion. Hallucination means you can have a visual hallucination or auditory hallucination. Hallucination in the sense you feel some unwanted noise hearing, like someone murmuring. It's actually there is an external object present, but you feel that someone is making noise or something exists there, but actually the object is not there. What about illusion? Illusion is the misinterpretation of the things. Like you are seeing a rope hanging on the window when you sleep in the night. You feel it as a snake. You know that it's a rope. Once or twice or thrice you have seen it as a rope, but still you misinterpret it as a snake. So instead of rope, you are feeling it as a snake. Or when you see a crack in the tiles, you feel it as a snake. So that is illusion. Misinterpretation of things is known as illusion. But hallucination means it can be due to a murmuring sound. You feel some kind of noises outside. So you feel as a murmuring sound as auditory hallucination or visual hallucination. The thing does not exist, but you feel it is existing. What about delusion? Delusion means it's like there are different types of delusion by persecution, by so many types of delusion. So delusion is a false belief. For example, if I am having a delusion, I think that someone is controlling me, someone is overruling me, like a remote car or something. Someone is remote control. Someone is controlling my power. Someone is powered, like they are controlling my all my thoughts, all my actions. Okay, that kind of false belief is delusion. Someone is behind me every time. Someone is every time telling something wrong about me or bad about me. So these kind of things are delusion. False belief is delusion. Delusion is actually a very difficult thing when it comes. Okay, it's not an obsession. Don't confuse with obsession. So delusion is different, illusion is different, hallucination is different. The person thinks that he does. If you tell him it is correct, the correct way, still he tells it that it's not correct. He tells that what he feels is correct. It's a false belief. It's not a misinterpretation. The person thinks that someone is controlling her, some human natural power, superpower is controlling her or him. So someone is every time talking negative about me. So all those things, false belief it is. If you try to correct them also, it is very difficult to correct them. But there are many medications for delusion, hallucination, because it's a combination of things coming as schizophrenia is the main thing what you see in psychiatry. A combination of delusion, hallucination, Okay, a negative symptoms, many negative symptoms can be there. So these are things of delusion, hallucination, illusion. Okay, so these separately it's a forensic medicine topic. Each is 5 marks questions or 3 marks questions coming in forensic. There are 8 or 9 types of delusion what you come across. So these are some of the, at least you should know what is delusion, what is hallucination, what is illusion. Okay, so hallucination, there is no external object present. Illusion, there is an external object present, but there is a misinterpretation. Whereas delusion is a false belief. These 3 things actually are catatonic symptoms, you can say schizophrenia. In schizophrenia, catatonic symptoms like delusion, hallucination, negativity, always it's a negativity. If I say something to a person, or for example, if I'm saying a person that you go to, like from here, to go to Darlagatte, he'll directly go to Kutta, he'll do the opposite thing what I see. It's negativity every time. So negativity is seen, or maniac, or depressive, the aspect of a person can be seen, depression can be seen. So these things can be seen as a part of schizophrenia. Main common example is staying because schizophrenia is a common example. So that's about something about delusion, hallucination. So see this picture. So he sees in the mirror as a king. He's a king. So misinterpretation of the thing. This is illusion. He sees himself as a king in the mirror. So it's an illusion. So this is some of the examples of delusion, hallucination, illusion. So every time everyone gets confused whether with these 3 things. Coming to the sensory disturbances. What are sensory disturbances? Sensory disturbance is a simple example. You can say something what I feel is like crawling in my hands or in my legs. Like it can be an insect, it can be an ant or a cockroach, whatever it is. I feel like something is crawling whereas it is actually not present. It is not actually present in there is no crawling of such things happening, but there is a sensory disturbance what I feel. So that's a sensory disturbances. So sensory system examination, what we learned is pain, touch, vibration, stereo, all those things. So here what we see, typical example you can tell it as sensory integration is affected as a part, for example, crawling of an insect or crawling of an ant or an insect in the hands or the legs or in the body. Actually it is not present, but we feel as something is crawling in our body. So that is a typical example of sensory disturbances. Okay. So next comes the emotional state. What do you mean by emotional state? So in the picture you can see happiness, sadness, fear, disgustion, anger, surprise, euphoria. Okay, all those things comes as a part of emotion state. I can be happy, can be sad. So there are many factors affecting emotion state. A person doesn't mean I may not be happy all the time. I not be sad all the time. It's a different kind of emotional. It can result in some of the things, daily routine things. For example, sleep can be a part. Your dreams, when you see some dreams in your place, when something affects in your life, some of your passes away, or your exam results, or a day spoiling, someone gets angry to you. So all those things depends on your mood. It can change the emotions. So euphoria or sadness, anger, surprise, happy kind of mood, happiness. Okay, all those things comes as a part of emotional step. So you have to be emotionally stable. So emotional stability is one of the thing which is also a part of higher mental function. So for example, the person, if what I am seeing in the morning, if I am not the same in the morning as well as in the evening, so something can affect me in between. Okay, might be the work stress or the family matters, the sleep, anything can be affect the emotional state. So that can also have to be assessed as a part of higher mental function. Now, for example, insomnia is an important thing what we come across as a part of emotional instability, because the lack of sleep, when you see a bad dream, so in the sleep, it can affect your the day, next day it can affect you. So insomnia can affect your emotional state, because insomnia is nothing but the lack of sleep. Okay, inability to sleep or lack of sleep, or it can be as a part of somnambulism, disturbed sleep, you getting and walking during the sleep, somnambulism. You might have seen the films and all. So insomnia, the daytime effects of insomnia include feeling very tired in the daytime, trouble remembering things, very difficult to recollect the things. So everything, the thought process is affected, the thinking, the memory is affected. So all those things are the problem as a part of insomnia, which can affect our emotional state. So this is an important part. Sleep and bad dreams can affect our emotional state. Okay, so not only happiness, sad, these all emotions comes as a part of our other things, so our basic things, the sleep, the appetite, the diet. Okay, even the food. Personally, I am a non-veg, so if I get a non-veg, I am very happy. So there are certain things which is a daily routine things also affects our mood. So it's a basic things which can affect our mood. Okay, so these sleep as well as bad dreams also affect the emotional stability. After emotional state, the next one is thought process and content. Thought process. What is thought process? Thought process can be stream thought as well as the content thoughts. Okay, the thought of content, the thought of the stream thoughts. The stream thought means the thought overlaps with the speech. Okay, the thought is overlapping with the speech. So there are different types of thought disorders. There is alogia, blocking, circumstantiality, clanging, derailment, echolalia, preservation. So echolalia is repeating the backwards again, repeating the words again and again. Till 3 years is a normal thing as a part of development, but later if you see it can be a part of autism mainly. Alogia is a difficulty in speaking in general. Blocking means difficulty in fully expressing or completing the thoughts. Then there is something on tangentiality and circumstantiality. Tangentiality means if I am starting to speak about a topic, I'll just talk about the topic and then just deviate from the topic. And then I never come back to the topic. If I am giving a topic of higher mental function, I started to speak about higher mental function and I go somewhere else and then I don't come back to the topic. That is tangentiality. What about circumstantiality means? Circumstantiality means I will have a topic, I start to talk about higher mental function, then I'll go somewhere else, some other topic I'll speak and I'll come back again. That's what, it's a roundabout manner. So speaking in a roundabout manner is a circumstantiality. So these are the different types of thought disorders. So streaming of thought, like live streaming. Stream of thought means there is a thought process going on with overlaps the speech. That's about the stream thought. What about content? The content means content can be even the delusion can come, it can have a hallucination, obsession can come in content, it can be as a part of fear. Okay, the content, thought of content, the content of thought can be as a part of fear. So these many things comes in the thought process and content. What is attitude? What is insights? Attitude means, or in attitude and insights together we can say it means that if I am having a disease, I should be aware of the disease, I should be aware of the complications, should be aware of the treatment of the disease. Insight is the understanding of a specific cause and effect in a specific context. In a specific context to understand a particular thing. So insight means you have in the social media like your Instagram or Facebook, can see the YouTube, the number of views, impressions on the sites. That's an insight, a piece of information. Or it can be introspection or act of understanding the inner nature of the things, like impressions or likes or shares or subscriptions, subscribers. That is what in a social media. So similar to that, insight or attitude here means to know or to be aware of the disease, to know the complications of the disease, to be knowing the treatment of the disease. So that is the attitude or insight. So it actually comes to the experience also, the attitude and the insight mainly regarding the disease is what we are talking about here. Okay, so to be aware of the disease, the complications or treatment of a disease, etc. So the power of acute observation and detection, discrimination and perception is called as intellection. Okay, so main thing, it could be a piece of information, it can be introspection, act of an understanding. All those things comes as a part of insight. That's about insight, attitude and insight. Next, coming to intelligence. There are different types of intelligence: spatial intelligence, naturalist, intrapersonal, linguistic, musical, logical, mathematical, and calculation. You're giving calculations. Everyone doesn't like calculation or maths, so you cannot give a calculation to calculate something and ask for the intelligence. So there are different types of intelligence based on the interest or based on the things. Some of them are not interested in anything. So that means they are not intelligent. So at least some of the other aspect of intelligence you can check by all these parameters. You can see different types of intelligence in this picture. So anything, you can give a calculation, you can ask about something about music, you can ask something about the linguistic intelligence or interpersonal intelligence, existential intelligence. So these things can be done. So simple thing what we do is that we give a calculation, simple calculation, or ask a person to tell from 100 to 1 or Z to A. Reverse order. Okay, so these kind of things can be checked as a part of intelligence. So there are different variety. Again, I'm telling you, you cannot give calculation for each and every one because there are many people bad in maths and there are some people very good in maths. Rest all the things are very bad. So intelligence doesn't depend on calculation only. There are different types of intelligence. Also, we have IQ scores. Like IQ scores is an important thing, especially in the pediatric and all. Not only pediatric but overall, IQ score is an important thing to assess the intelligence level, the genius. Okay, so we have this different scores level. 160 plus can be genius, 1 to 70 is low. So based on a different set of questions and different things, they calculate the IQ score. The intelligent quotients, that IQ score, can be calculated based on several their set of questions are there. So that also can be done as a part of the higher mental function. So after intelligence, then comes the memory. How to check for the memory? Memory actually can be divided into three categories or three types: immediate memory, recent memory, and remote memory. Remote means long-term memory. Immediate means immediately, within seconds or within minutes. You can give a number, you can give a sentence and ask him to repeat after 10 minutes. You can ask him, what did I ask you? What was the number I have given you? So after few minutes, you can ask them. That is the immediate memory. Recent memory means, recent memory you can ask about the breakfast, you can ask about the dinner, what you had yesterday. So suppose today, now it is afternoon, you can ask about yesterday's dinner or yesterday's breakfast. That is a recent memory. Okay, from in what vehicle you have you have traveled yesterday, where did you go yesterday, along with whom did you go. So a recent memory can be checked in that way. What about long term memory or remote memory? That is like long back, like 10 years back. Okay, where was the schooling done, where was your LKG done, because now you are a first year student, so I cannot ask you plus 2. That you cannot tell as a long term memory. It's not more than 1 year. So long term memory means what happened in 5 or 6 years back or 10 years back. Long term memory. Okay, like where did you do a school? Do you remember the thing? You forget about that. That's immediate, not an immediate or recent memory. It's a long term memory or remote memory. It's very important in things like your schooling or your teacher or your the place where you have stayed. All those things comes as a part of long term memory. Then forgetting the things can be due to even amnesia. Retrograde amnesia can be there as a part of road traffic accident. A blow in the head can have resulting in an amnesia. So these things, sometimes the person who has brought to the casualty, even here the person doesn't remember what has happened in the road. He just remember might be he's traveling in a car. He doesn't remember anything after that. That can be even 1 or 2 days. It will be okay. Okay, for that this type of memory is very important. Recent memory or immediate memory is very important when to ask when there is a head injury or a blow in the head. So forgetting can be as a part of that. It can be only for 1 or 2 days. So observation is very important when you have a head injury, especially 48 hours is very important. The first 48 hours to have observation in an ICU, and sometimes CT or MRI has to be taken to rule out any head injury, any injury to the brain areas. What else you can see for the memory is that you can see the numbers. You can give the numbers. What I am showing the pictures right now. In earlier also I have shown the pictures. What are the 2 numbers ago? What you can see? What are the 1 number ago? So like a reverse process, or asking him to tell from the back to the front. Like 473 is given. So 2 numbers ago, what is that? So that's the one of the way you can see for the one of the thing again for memory or even intelligence. So you cannot exactly say memory, it can be intelligence also, or you can say reasoning also. There is something known as reasoning. The reasoning, you're giving a numbers and ask him to identify the number. So everything comes as an example. You're giving numbers, intelligence, memory, and as well as reasoning. Now after memory, we have something known as judgment and reasoning. Reasoning I just told along the numbers, but still again judgment and reasoning. What is this judgment? Judgment, you can say, you can give a scenario to the subject, to the patient, asking him what happens if the house is in the fire, or what happens you see a road traffic accident in front of you. So the judgment should be good enough that if suppose someone is asking me what happened, what do you do when you have when the house is in fire? When I am staying in a house, my house has got fire. It is like what should I do at that time? If I am telling I'll stay there itself, let my house goes continues with the fire, let it burn. If I'm saying in that way, that means I am a psycho. That judgment is wrong. So you have to see the judgment, what the person thinks. Okay, you give a scenario, what does he do when he sees a road traffic accident, or what does he do when his house gets fire. So obviously what is road traffic accident, he try to make the scene safety and just call the ambulance, try to rescue the person there. In fire in the house, first he tries to be safe. Every house members in the house has to be safe. He makes sure they're safe and call fire safety. He tries to pour water on that and tries to, the first is scene safety. For anything is scene safety. So that's the answer we are expecting from them. Okay, so depends on that you can tell the judgment. Okay, he's normal or not. It's not a pagal wala or a mad fellow telling that I will stay there, fire, nothing happens. Those kind of people means the judgment is completely wrong. So this is a scenario is given to them, and you have to assess the judgment of that person. Okay. Even reasoning also have to be done along with that. So how can you do reasoning? Means reasoning can be done either you can give a proverb and explain them the proverb. Like for example, time and tide waits for no man, or an apple a day keeps a doctor away. So these type of things can be an example. Proverbs can be given and be the reasonable what reasoning they are giving, that can be done. Or you can give a puzzle. or a max puzzle, a calculation, how does they reason it? Okay, how does they find it out? Or you can give a thing, you can ask them to arrange a chase in a particular way and see the reasoning, how they are, the reasoning, how to judge the reasoning, how to assess the reasoning. So these things can be done. Mainly the max problems can be given as a puzzle, so those things can be given, and it comes as intelligence as well as reasoning. Both comes together. If you give a puzzle or a calculation, you can assess the intelligence as well as reasoning. Addition or subtraction, whatever you can give as an example for reasoning or intelligence can be assessed by giving a puzzle or a problem. Okay, so that is a part of reasoning. So judgment and reasoning together, giving a scenario of a house fire or a road traffic accident and asking him to solve a problem is a part of our judgment and reasoning. Next, coming to the last part is language and speech. Language and speech, the areas related to language and speech is mainly the Broca's area and the Wernicke's area. Wernicke's area 22 and the Broca's area 44. Okay, it is in the part of the area of the brain, mainly it's related to the Broca's area is for the speech production, and the Wernicke's area, even Broca's area for the language as well, and the Wernicke's area for the language. So if you should know something about aphasia and dysarthria mainly when you come across language and speech. What is aphasia? Aphasia, if there is any problem in the Broca's and Wernicke's area, means the language is affected. The different types of aphasia, Broca's aphasia, Wernicke's aphasia, anomic aphasia, global aphasia, etc. So the aphasia means it is the problem in the language, the language developmental areas like Broca's and Wernicke's area. So what is dysarthria? Dysarthria is a motor speech disorder. It can be told as or it can be called as slurred speech. Okay, dysarthria affects the movement of the individual speech muscles. The muscles are affected, which can result in the speech disorders. So it can vary from mild slurring to completely unintelligible speech. So slurred speech is a typical thing what you can say for dysarthria. Now there is something known as echolalia. What is echolalia? Until the age of 3 years it's a normal thing. Developmental, when you take as a developmental age until 3 years, it is a normal thing. You can see the 2-year-old baby or 3-year-old child, they find difficulty in telling, they repeat the words again and again. So an example for this I can say, after 3 years if you are seeing echolalia, it is an abnormal thing. Like for example, you can see autism. Have you seen the film My Name is Khan? In My Name is Khan, Shah Rukh Khan is having autism, Asperger's syndrome. So in autism, a typical example for echolalia is autism. But until 3 years, it is a normal thing. A developmental age, until developmental age, it can be regarded as a normal thing. But after that, if you find out echolalia, it has to be evaluated and see whether it's a part of autism or Asperger's syndrome. But doesn't mean that every person with echolalia is having autism. Doesn't mean like that. Okay. So this is all about higher mental function. These are the list of things what I have discussed today in the last half an hour. So this is only just a few things I have discussed. There are a lot of things when you go to psychiatry and medicine. I hope this is enough for the first year. So ultimately you have to write the report. The report you have to write is the higher mental function examination of Mr. or Mrs. or Miss so and so name aged so and so years is found to be clinically normal.